Yo, what's up guys? So I wanted to share a case that I had today at the clinic. I thought it would be a good learning experience for those of you who are students or just graduating. But essentially I had what was she, about 35-year-old female who came in and she was complaining of hand pain. She had bilateral hand pain, right? And she was diagnosed with carpal tunnel. She said this pain has been going on for approximately 4 to 6 months. She's not quite sure, but about 4 to 6 months. And she does a lot of cleaning. So she's a maid. And she does a lot of cleaning, and for this reason they were diagnosing her with carpal tunnel. She has hand pain, bilateral, symmetrical, and aggravated while she's at work. Carpal tunnel, right? The problem is she wasn't getting any better, and they were thinking of maybe doing nerve conduction studies. Anyway, she comes into our clinic today, and so I asked her a little bit more, and she says, every time I go into the freezer, for whatever reason she has to go into a freezer, the hand pain gets worse. So I asked her exactly where the pain is exactly, and she said it's on the fingertips, right? So it's not the entire hand, but it's on the fingertips. So I asked her if she's having this pain right now, and she says, yes, I am. And I look at her fingertips, and I don't know if you can see, but this here was completely white. So it looked like that, right? However, it was all over 5 fingers and on both sides. So it's bilateral, fingertip pain, discoloration. And she said, over the past couple of weeks, I've noticed this on my toes. So obviously this is not a carpal tunnel, this is Raynaud's, and she's going into a freezer, right? So Raynaud's is it's commonly aggravated by cold exposure, whatever that might be. So for her, it's going into the freezer, aggravates the pain, causes Raynaud's, and boom, we're done. Good thing is she just had blood work done a couple of weeks back, a month back, and everything came back normal. So the only thing we did is do an ANA just to make sure, because a lot of times Raynaud's is associated with autoimmune processes, lupus, scleroderma, things of that nature. So do an ANA just to make sure. Starting her on nifedipine, and we will see her back and see how she's doing. Anyway, it's very important that you not necessarily spend, at 20, 30 minutes with your patient, but to ask the right questions. It's important that you're present. Even if you're there for 2 to 3 minutes, 4 or 5 minutes, those 5 minutes need to be quality 5 minutes, right? Because if you're not present, you're not asking the right questions, you're not examining the patient, you're not looking at her fingertips, they were clearly white there in the exam room. So it's very important that you ask do a good history, do a good physical exam, and lots of times that's going to help you with the diagnosis. So that's what I wanted to share with you guys. Hopefully you guys learned something from this. Remember, ask questions, do a good physical, I should say. All right, take care guys, and I'll see you guys later.